Hi guys! In this video I'm going to talk about metatarsal stress fractures. We're going to look at which ones are seen as high risk versus low risk stress fractures, basically due to healing times or whether they heal or not. We're going to look at how can you tell if you've got a stress fracture, and also the most common causes, how you can prevent them, and absolutely how you can treat them and get back to running again. So for those of you who don't know me, my name is Maryke. I'm one of the physiotherapists from sportsinjuryphysio.com, where you can get online physiotherapy assessment as well as treatment for your injuries. Have a look at the description of this video if you want a link to our website. Okay, so if we think of the metatarsal bones, they are the little bones in your foot that connects your toes to your midfoot. And you have, when we talk about the metatarsal bones, you'll often see people say the first, the second, the third, fourth, and fifth. And it's basically just your first one relates to your big toe. The fifth one is the one that is for your little toe, and of course the three in the middle then. Now, when we look at the metatarsal bones themselves, the portion closest to you or closest to your ankle bone is seen as the base of the bone. Then we have the shaft, which is the long middle bit, and then you've got the head of the metatarsal bone. Now, you can get a stress fracture in any part of the bone, but there's certain ones that seems to be high risk, that they don't heal that well. And it's a combination of how much pressure goes through that area in the foot when you walk or run, plus how good the blood supply in that area is. Now, if something is a low risk stress fracture, it means they heal pretty easily. If you just offload them, give them a bit of stability, not an issue. If it's a high risk area, then it means that if you don't offload it dramatically and really look after it, they likely are not going to heal well, and they may even require surgery. Now, if we look at the ones that seem as low risk, it's any of the shafts of the middle three metatarsal bones. Their shafts heal quite easily. The fifth one is a little bit of a, let's call him a little bugger. Any part on the fifth metatarsal bone struggles to heal. And if you don't treat that quickly and you don't treat it quite aggressively with offloading, then you may end up needing surgery. The other area that seems to be a high risk area that doesn't like healing that easily is the base of the metatarsal bones. They tend to be a little bit delayed in healing if you don't treat them well. And the current recommendation is that you don't send somebody back to sport just because they don't have symptoms there anymore. It's best to have a scan and just check, has it properly healed? So if we think of the causes for these stress fractures, then overload is the number one cause for that. People like to dig into biomechanics. Oh, it's because you run in this way, your foot turns out in that way, that's the cause. But more often than not, it's just about overload. Now, what do I mean with overload? So if we think of, as you sit there today, your body has a base strength. So your bones, your muscles, your tendons, your ligaments, everything has a certain strength to them at that point. And that strength is determined by what you've done in the last few weeks, last few months, up until this point. If you lie on a couch for 4 weeks, you'll lose some of that strength because you're not using the body. If you train, you'll build some strength in it. Now, every time we do an exercise session or any activity that loads an area, we get micro damage in that area. And that's absolutely normal. That's what we want, because it's that micro damage that signals to the body that, you've got to rebuild me stronger because this person wants to do this activity. Now, if we think of bones specifically, if we do impact activities, you get the microtrauma. As you rest, the bone recovers and repairs the microtrauma, and then you're stronger than before. And if you train in this area where you've now got stronger bones than before, you build on top of that and you get stronger over time. However, if you train before you've fully recovered, then the micro damage actually accumulates. And then that's when you get overuse injuries like stress reactions in the bone or stress fractures and even tendinopathies and stuff like that. Now, there are certain things that can predispose you to this as well. So if we think of, training loads that can predispose you to this is if you have a sudden increase in the volume of training you do, or just the terrain changes. So there's a lot more downhill running or fast running sessions that you're doing. If you don't recover well because your sleep is interrupted or you're not getting the nutrition you should have. So if we think of it, yeah, it's great that you give yourself enough recovery time, but if you don't eat enough in calories and nutrients to replace what you've burned, you just don't have the building blocks in your body. So your body can't repair that. And it usually decides on, it looks at what's most important for your survival. So it will always look after the most important organs first. And then if there's nothing left for the rest of you, it just won't repair the rest. So those two things are really important, or three things: looking at training loads, looking at your recovery, and looking at what you eat. Then other things like shoes is something to keep in mind. So if you make a sudden change in the type of shoe you wear, for instance, the two most common things that springs to mind is if you go from cushioned shoes to minimalist shoes or even barefoot running, because your metatarsals will then be used to a certain impact, but it's used to the cushioning. So now you take the cushioning away and suddenly there's much higher forces on it. Now, if you do it slowly over time and you ask it to run with the higher forces just for a few minutes a day over several weeks, and you slowly build that up, you'll give them enough time to rebuild themselves stronger. However, if you just switch to those new shoes and you do your normal mileage in that, the bones won't have enough time to rebuild in that period of time, and the load will be too much, and you'll predispose yourself to stress fractures in those areas. Also, if you suddenly use a shoe that just makes your foot supinate more, so it rolls out more, that will load the outside of your foot more and can lead to injuries to your foot metatarsal. I need to chat about the difference between fracture and stress fracture in a minute. I'll do that. Then other things like vitamin D deficiency. That's a big culprit really, especially for anybody who lives far away from the equator, who has long extended winters and who don't necessarily see the sun that much in the summertime. Vitamin D is extremely important for bone health because you can only absorb your calcium in your diet if you have enough vitamin D. So if you have a stress fracture, it's a good practice to get your GP to just test your vitamin D levels as well and see if you maybe needed topping up of that. Then there are other illnesses and other conditions that can cause bone mineral deficiencies as well. So if you have a history of osteoporosis in the family, it may be worth checking that out, because if you can get that treated early on, it's much easier to turn it around. Now, what does a stress fracture feel like? So usually the pain builds up over a period of time. So it will feel a bit of achiness while you're running, be a bit sore after you've run, but then it'll settle down, it'll be okay until the next run. But then as it progresses and gets more and more irritated and worse, you may even have pain with normal activities like just walking or standing, or sometimes even at rest. And this is because initially you only get a bone stress reaction. So you don't get a full-on fracture to start with. If you looked at it on an MRI scan, you'll see there's a bit of swelling in the bone. The bone just looks as if it's irritated. But if it continues to be irritated and overloaded, then you can get a proper fracture line, but it's still together, it's not displaced. And then a grade up, you can actually get that it displaces. Now, you can't see the early stages of a stress fracture on X-ray. They're just not useful. They can't show you that. It's only MRI scan that can show you that. But you don't necessarily need an MRI scan initially. If your clinician is skilled enough to listen to what you're telling them, take into consideration how much training you've done, and do a proper examination. So usually for any stress reaction in the bone, if you want to suspect that, the bone has to be tender to press on. There are other things that can feel like a stress fracture in your metatarsal. So if we think of the ones over the metatarsal, the base of the metatarsals, then metatarsalgia, which is an overuse injury where you get irritation of the soft tissue as well as the bones in that area, can feel very similar. Morton's neuroma is where the little nerves get irritated between the toes or the metatarsals, and that can cause pain that can feel similar to a stress fracture. If we think of the fifth metatarsal, then you have your peroneal tendons attaching into this area. So if you have a tendinopathy, it can give a very similar pain as a stress fracture because it can also be painful on the bone there. So it's worth having an examination and then also just confirming it with a scan if it's not reacting as you would expect it to react. Now, treatment-wise, treatment will very much depend on what type of stress fracture you have, in what area it is, as well as how advanced it is. If it's just a stress reaction, that there's no proper fracture line or anything yet, then you may just need to reduce the load on that foot. You don't necessarily need a boot or anything like that, but it may mean that you use some crutches for a while if it's that bad, or you just don't walk or run on it. You try to limit your time on feet. If it is a proper stress fracture, especially in the area where it is high risk for not healing, so the base of the metatarsals or on the fifth metatarsal, you'll likely get stuck in a boot because you want to immobilize that area as best as you can to allow the bone to heal. Now, bones do well with being kept still for a while to allow them to heal, but then they really want to be reloaded over a period of time. So when you come out of that boot, or the pain settles enough that you can start weight bearing on it, your physio will usually help guide you that you start a progressive loading program where you slowly build up your time on feet and you do strength exercises that loads that area over time. But it's best to just make peace with it, that it will likely take you about 3 months to get back to running. And if you try to rush it, you'll likely just end up overloading again and having to start the progress from scratch again. But doesn't mean you have to do total rest. You can do anything that doesn't load that area. So if we think of stuff like that, cardiovascular exercise, swimming, brilliant option. Later stages, if it starts accepting load in the water, you can do some jogging in the water. You may be able to do some cycling depending on what stage you're in and how much pressure goes through that part of the foot, if it allows you to do that. Rowing could be another option. Sometimes you just need to adjust how your foot is on the pedal to offload that area. Also, there's nothing wrong with the upper body or the core muscles, so you can start doing exercises for those, keep yourself fit and strong. Again, just take note of how much pressure do I put through my foot. Is it through the injured area? Because you don't necessarily want that at the beginning. But as you grow stronger, you do want to load it a little bit. But it's all according to pain, that you don't want to stir up the pain as you reload it. Now, I often get asked, how do I know I'm ready to go back to running after I've had a stress fracture? Well, there's no magic ping, now you know you can go back. It's about building up slowly towards it. So when I decide whether you're ready to go back to it or not, I'll be looking at what have you done in the last week or two? How much walking have you been able to do? If you've not been able to brisk walk yet, there's no ways you can run. So we've got to build up the walking and your speed in walking before we can get to run walking, for instance. We want to look at your heel raises, for instance. If you can't go up on your toes, up and down with a bit of extra weight in your back, and that still irritates your foot, no ways you can run. Because when you run, it's forces of between, well, depending on what research you read, 3 to 6 times your body weight just through your Achilles tendon and your calf. So it's very similar to that goes through the foot. So you want to be able to tick those boxes that you can do certain exercises without aggravating it before you transition back to the running. Now, often people feel that there must be something wrong with how they move or their body, and that's the reason they got the stress fracture. Now, in a very small proportion or portion of people, there may be some biomechanical factors that could help if you changed it. But I want you to really clearly understand that there is no perfect running form. There is no, you have to run like this if you want to be injury free. Our bodies can adapt and grow strong in any position of running as long as you don't load it too quickly, as long as you allow it that time to adapt to it. So biomechanics is not the first thing to try and change, especially if you've run for years and years and years without an issue. Then it's not biomechanics that's your issue. So before you start worrying about biomechanics, just get yourself strong top to bottom in your normal positions and movement patterns that you have, and then look at your load management going back, that you don't overload too quickly, that you look at your training load and make sure you've got enough time to adapt, and look at your nutrition, that you've got that sorted. If it still remains a problem, then you can start looking towards biomechanics, and you may benefit from seeing a podiatrist if you really supinate dramatically, because it could be as easy as just choosing the correct shoe that doesn't allow that much supination, or getting an orthotic with a little bit of a wedge on the outside that just stops it from rolling quite so much. So yeah, definitely for me, the first thing is get your load management with training right, make sure all your muscles are strong, and get your nutrition right. And then you can consider whether you still need to change anything in biomechanics. But it's not the first thing to do. Note to self, I nearly forgot. The big difference, you can get an acute fracture in this area as well, not a stress fracture, by rolling your foot suddenly. So just something to point out, I should have said this under how does it feel when you've got a stress fracture. If you've turned your ankle and you suddenly have pain in this area, have it checked out. X-ray could even be useful, because it's much more likely that you may end up having a fracture rather than a stress reaction if your pain came on suddenly after you've twisted your ankle or something like that. So that's just something to keep in mind. Very well. I think I've said everything that I've meant to say. Let me know if you've got any questions. And remember, if you need more help with an injury, you're welcome to consult one of us via video call. The link to the website is in the description of this video.